Hello, I'm Dr. Chris Marshall here at Medical Specialty Clinic, and today I just wanted to talk a little bit about GeneSight. So this is a test that we offer now at the clinic here, and I'm very excited about it. I've actually had this test ran on myself, so it's a simple test to get. It's just a cheek swab. They swab inside the cheek, both sides, send it in, and it will determine your genetics for several enzymes that are involved with medication metabolism. So it can help determine if you metabolize certain medications normally, or if you metabolize them very fast, which would make them not work as well, or if you metabolize them very slow and the metabolites would build up and you'd be very likely to have side effects and not get any benefit out of the medicine. So this can really help when your doctor's trying to decide which medication to start you on. And certainly if you're already on a medication, it doesn't seem like it's working, maybe not working well enough despite pushing the dose up. This could be very beneficial for a lot of people. So I'm really glad we started offering this, and I've had several patients get some benefit from it already. As you can see on the report, this test basically breaks down whether to use it as directed, if you have normal metabolism, or if there's some caution that you should use with the medication, or if because of your genetics you should stay away from it because you have more likely to have side effects or some other problem with it. And then there's actually little footnotes off to the side. So for example, some medications that I would probably not do well with would be Zoloft and Paxil, or sertraline and paroxetine. Paxil specifically, it gives me two footnotes. One is that my genotype may impact the mechanism of action of the drug and result in decreased efficacy, and the other would be increased risk of side effects from this drug. So really helpful. And it has several other reports, anxiolytics and hypnotics. It goes through antipsychotics. So you can see medications like Abilify, Seroquel, Risperdal, clozapine, Zyprexa, some very commonly prescribed medications. So this could be very useful for people. Mood stabilizers. Just as a side note here, there are some medications that do not really have genetic markers that can help us determine if the medicine is going to work well or not. And some of those would include gabapentin, lithium, and Topamax. But others are, so trileptal, Tegretol, Lamictal, valproic acid, some of those can be determined from this. Then there's a report on stimulants, so medications like Ritalin, Focalin, Strattera, and also it can help you determine how well you metabolize folate and folic acid. And so there's a lot of research on that right now. Some people have trouble with folic acid metabolism, and that can cause all sorts of trouble. I'd encourage you to read more on this, folic acid in particular, and certainly GeneSight. And if you're interested in having this done, you can come in and we'll be happy to talk to you about it, see if we can get it set up. Most of the time, insurance will cover it. We'd love to see if we can get you feeling better. If this is something you think might benefit you, just give us a call. Thank you.